Well, a lot of people going to pharmacies right now are here for that third shot or that booster. That's what health officials are telling all eligible adults to get. So, to hear about a second booster shot already, so a fourth COVID vaccine dose, we wanted to know how likely is that? This week in Israel, a group of healthcare workers rolled up their sleeves for shot number 4, a second COVID-19 booster.
Hopefully, we'll be able to show here that this fourth booster really provides protection against the Omicron, which is highly needed.
So, what's wrong with just the first booster, and why do we even need it? One big reason: Omicron.
There were a lot of breakthrough infections, so there was an attempt to try and prevent that from occurring.
Dr. Hannah El-Sali, professor of molecular virology and microbiology at Baylor College of Medicine, says there was also evidence that protection against severe disease was waning in some with just 2 shots. But overall, especially with the booster, most people are still okay.
The overwhelming majority of it is mild to moderate disease, if not, and with Omicron, it's even closer to the mild spectrum.
There is chatter about a fourth dose.
Mm-hmm.
Is that a real possibility here in the United States for everybody?
Unlikely, at least as of today.
Here's why. A fourth dose might stop you from getting COVID for a few weeks or months, but now health officials agree we're probably all going to get COVID-19 at some point. The goal now isn't prevention of the disease, it's protection when we do get it. Dr. El-Sali says those 3 current doses do offer protection from getting really sick or dying.
Do you think at some point it might be, okay, well, you don't have to get another booster every few months, but maybe every couple of years, every 5 years?
That is the next phase of research.
One thing we do know, as the virus changes, we have to adapt too. Isn't that the truth? You should know there are other vaccines being developed that could maybe protect us from all former variants and any future ones. They call it a super vaccine. No promises here, but scientists are working hard to try to figure that out. I'm Lauren Tellerico, KHOU 11 News.
With the very latest, thank you so much, Lauren.